move next to our next presenter. And Cati Semadeni did her practicum at Community Medical Center, and her site mentor is Julia Carlson, who's a clinical educator in the NICU there, and NICU being the newborn ICU. And the name of Cati's presentation is G-Tube Care Enhancing NICU Discharge Experiences for Families. So Cati, I'll let you take it away, and I'll let you describe what the G and the NICU stand for to be inclusive for everybody involved. So take it away.
Hey, hi everyone. My name is Cati Semadeni. As Lee said, my site mentor is Julia Carlson, who is a NICU nurse at Community Medical Center, which is the site that I did my practicum at. And just to start, I want to provide some definitions so that we all understand what I'm talking about. As Lee said, the NICU is a hospital intensive care unit that provides specialized care to ill or premature babies. And something that we'll see in the NICU is a gastrostomy. And that is a surgical procedure that's used to insert a tube through the abdomen into the stomach. And that tube is called a G-tube, which is what I'll refer to throughout the presentation. But again, that's inserted through the belly, and it brings nutrition or medication directly to the stomach. So there can be a variety of different reasons why infants might need a G-tube, but some of the most common are eating or swallowing disorders or anything that's going to inhibit them from getting the nutrients that they need. So if you look at the diagrams here, you'll see there's the balloon part, which is inside the stomach, and that's filled up to help keep the tube in place. And then the only part that is outside the body that rests on the stomach is the port or the button, and that just connects directly to the feeds or the medicine. So the two products that I did this semester was first a survey and needs assessment, which I did for caregivers that have children with G-tubes. And I opened this up to any caregiver. We delivered the survey through Facebook groups, so it really was anyone that had access to the Facebook group. And then I used those findings to inform my educational binder, which is a comprehensive guide for parents in the NICU to take home with them that really just provides as much information as possible so that they can go home feeling prepared to care for their child. And here are the competencies that were fulfilled throughout the semester. Foundationally, I assessed population needs, assets, and capacities. And then I designed a population-based project, and I performed effectively on interprofessional teams. And then as far as concentration-specific competencies, again, I assessed needs, resources, and capacities, and then I planned and implemented a health education program. So to dive a little bit deeper into the survey, I was amazed because I had 117 respondents, which was a lot more than I was hoping for, so I got a lot of really great data. But some of my objectives for the survey were to really understand caregiver experiences and then to assess the discharge education. So discharge is when the families are leaving the NICU and heading home to care for their child on their own. And I really wanted to see areas that worked and then identify areas of improvement so that we could make it more comprehensive to just better equip the parents to care for their children. And then among the findings, these were some that I thought were really interesting. So 32% of caregivers believe that they did not receive sufficient preparation and education from healthcare professionals prior to discharge. 42% rated the transition process to home care as either difficult or very difficult. 45% felt either unsupported or that they could use more support. And 21% did not have a second support person in the home to help care for the child. So really an overarching theme here is just the need for support. And this doesn't necessarily come as a surprise because caring for a medically complex child is really overwhelming and stressful. But it really outlined a gap to fill to provide more comprehensive education that, again, makes these parents feel equipped and prepared to head home and care for their child effectively. So these are verbatim some respondent suggestions that they offered in the survey. And the things that I bolded here essentially are describing what my binder is. And which was really cool because before I even made the survey, I knew I was going to create a binder. And it was really affirming to see that this was an actual need that participants from the survey were outlining, and said that would be a really helpful resource for them. So moving into the binder, here are just some screenshots of the binder. I think the total binder ended up being 48 pages or so. And so there was a lot of really great information that I created with the help of a big care team. But I want to point out on the feeding plan and follow-up providers page, there are some blanks. And I did that so that either the nurse or the provider could go in and fill the information in pertaining to the specific child at hand. And so that way the binder is completely customized for the family. And so that they're having the most accurate information, because there are a few discrepancies depending on situations and children. And I really wanted the binder to have all of the information in one spot to be really easy to read. And then you'll also notice I put some illustrations and step-by-step guidelines, because that consistently came up in the survey as something that caregivers wanted to be helpful. And again, just to make sure that they're knowing exactly what is needed of them, because we're recognizing that this is a really stressful situation and there's a lot of components involved with G-tube care. Another big part of the binder is the resources section. So this came up with a lot of caregivers wanting to be connected with resources. If you think about being in the NICU, they have so many resources at the tip of their fingers with just nurses and providers, and they're getting consistent quality care. And then transitioning to the home can be really scary because that care stops. And if we're specifically thinking about Montana, it's more geographically isolated, and there's a lot of rural communities that come to the NICU at CMC. And so I really wanted to provide a comprehensive resource section so that they didn't feel like they were alone, and they knew that there was options available for them to help assist with that transition. So I spent a lot of time finding Facebook groups, YouTube videos, websites, and then federal assistance resources that hopefully were really helpful for caregivers so that they had that continued support. And throughout the project, there were some barriers and challenges, as with any project. One of the biggest ones was my own lack of experience and knowledge. I am an aspiring nurse, but I'm not a nurse yet. And so I had to spend some time learning the nurse jargon, and I kind of felt like a new caregiver in the sense that I had to learn what a G-tube is and what it looks like and how to care for it. And so not having that nursing background was a bit challenging, but also really, really cool to be able to learn all of those things. And then G-tubes are a bit niche. They're complex and not everyone knows even what they are. And so it was challenging to find really standardized, consistent information and ensure that the information that I was putting in the binder was accurate and helpful. And especially considering Montana and again, how geographically spread out we are. There was just limited resources and access to professionals that really specialize in G-tube care. And so I spent a lot of time ensuring that I was finding resources that would be applicable to Montana residents. And with that, there was, just a lot of information overload because there's a lot to learn. And I even spent a whole semester focusing on it. And I was overwhelmed. And so I can only imagine what caregivers feel in that sense. But it was a lot. And I really wanted to present it in a way that wouldn't add to the stress and overwhelming nature for caregivers. But I did learn a lot throughout this project. One of the big things was interdisciplinary work and communication. The G-tube care team had so many different providers, and there was consistent lines of communication throughout. And it was really cool for me to be a part of that and to work with so many different providers and learn a lot from different people. And then a big thing I learned was the power of education. So being a public health professional, I love education, but it was really cool to see how this comprehensive education really made parents feel empowered and helped with the outcomes of their children. And it made me also think about caregivers that might experience barriers to this comprehensive education, whether it be financial limitations or geographical constraints or socioeconomic status or anything else, recognizing those barriers and still ensuring that they're getting the quality comprehensive education that they deserve. Because at the end of the day, we're talking about the livelihood of infants, and that's really important. And then in a similar vein, I learned that details are so important. There was a correlation between providers and nurses that really paid attention to the details and focused on those. And the parents felt better and more prepared leaving the NICU. And again, their children's long-term health was a lot better too. And so I think just recognizing the importance of empathetic care was really cool. And then lastly, learning that listening goes a long way. There were so many people that wanted to share their story and give insights, and they felt really empowered in doing so. And it was really, really eye-opening to learn from them and to give them that platform to share their stories. So with that, thank you so much for your attention. And if you have questions, you can put it in the chat or contact me directly at any time. But thank you.
Nice, Katie. Thanks so much.